I'm presented, every day with the question, well, why aren't you using saliva testing? Well, first of all, you can't measure peptide hormones in saliva. And the pituitary gland, which is the gland that produces these peptide hormones, is what tells you whether or not you have adequate amount of thyroid or adrenal hormone or estrogen in your system. And so these peptide hormones are critical to the evaluation of whether or not you have enough of these hormones in your system. And you cannot get those out of saliva. Saliva may measure the hormone itself, like estrogen or testosterone or cortisol and those particular hormones, but it means nothing if you don't have the ability to correlate what that hormone value is versus the pituitary hormone. Because if you just give me an estrogen level, I can't tell you if that's good or bad. I can only tell you if it's good or bad if you tell me what the peptide hormone from the pituitary says, which is the FSH. Then I can marry those together and say, yes, that level is normal, or no, it's not, it's abnormal. Because if the peptide hormone is really high, that means that that level of hormone, which could be normal in saliva, by the way, it may show a completely normal, I see that thousands of times, a normal saliva test, and these people are hormonally deficient because no peptide hormone from the pituitary has been measured. And those peptide hormones are TSH, FSH, ACTH, and those cannot be measured in saliva. So you have to use true science and not just spitting in a bottle science. You have to use true science, which means draw the blood, get the right hormone, and then make a decision whether or not that person is deficient or in excess or normal. Treatment options, which I've employed a multitude of those until I started using the pellets that we use here at SottoPelle. Our creams are one of the most common forms of therapy. Now you can go to a compounding pharmacy and you usually get the same recipe of cream, and it's usually applied in the same manner, either once or twice a day. There are pills, there are capsules, there are sublingual tablets, there are injections, there are oils, there are a multitude of different delivery systems, none of which can approximate what a pellet therapy does, because they all control the body and they don't reshape physiology, they only create some symptom relief. Whereas when we use SottoPelle's type of therapy, using the pellets, we find that we actually change the internal environment, and when that happens, then cerebral function starts to return, cardiovascular protection returns, musculoskeletal function and protection once again returns, and metabolically the patient becomes better because the hormone once again is being secreted exactly like the human ovary or testicle would do, which is a continuous secretion of hormone, the right amount at the right time, and it's being controlled from within, because this is the only form of therapy in which the human body controls the release of the hormone through the action of the heart. And so therefore, the body once again controls the release of hormone as it did when the ovaries or testicles were functioning. Andropause is a condition of the human male that when they develop testosterone levels that are below functional levels, they begin experiencing symptoms of muscle loss, fatigue, lack of energy, lack of desire, lack of motivation, fat deposition, expanding waist, expanding hip size, developing problems with mentally, such as anxiety, depression, loss of memory, poor recall, and not being able to multitask and problem solve like they have in the past. So it's a condition not necessarily generated by age alone, in which the adult male becomes non-functional. The majority of males that enter into andropause usually enter into it around the age of late 40s, early 50s, but it can happen even earlier than that.